Good.
I'm Michael Platt, I'm a otolaryngologist at Boston University, and I'm going to explain technique for nasal sampling of the inferior turbinate for acquisition of respiratory epithelium for genomic studies. You can see here a picture that I drew of the nasal cavity, and what you'll notice is that in the center there's a wall called the septum. That is not what you want to brush. That is the thing that typically bleeds and also is what is very painful or tender. On the side walls of the nose you see turbinates, these soft mucosalized structures, and here I drew in exactly where I want a brush to be, on the inferior portion of that turbinate. The best way to visualize the nasal cavity so that you can do this is by using a light source, a headlight, so that you have two hands free, as well as a nasal speculum, a small instrument that just helps open the nostrils. And once you can see the turbinate, then you can be sure that you're sampling the correct part without causing any pain or any bleeding. To do this, you have the subject look directly at you, and I'll insert my speculum into the nasal cavity. Some people like to put a finger on the nose to stabilize, but you don't have to. And then I will gently open the nostrils, and I have a direct view of that turbinate. It is important that when you pull out the speculum, you pull it out open so as not to pull out any nose hairs. This can be done on either side with a good view of the inferior turbinate. In order to collect your sample, you first clean with Zap your wire cutter and wipe it down. Take a sterile brush. Some sites may elect to spray a topical numbing medicine. This is 4% lidocaine. There are many ways to apply it. The easiest way is with this atomizer bottle that just gives a spray into each nostril directly at the turbinate. You can tell subjects that lidocaine tastes bitter. They may taste it. If you're injecting it with a syringe in larger volumes, then there's a good chance they will taste it. However, with a small spray, they usually do not taste the bitterness of the lidocaine, and it does work after just a few seconds. It's pretty quick. For those sites that choose not to inject with lidocaine, it also is a fairly painless procedure, and it's acceptable to do it without lidocaine. I'm going to first start on the right nasal cavity. I have a good view, and I'm going to take my brush, insert it right under that turbinate, and I do 2 spins, and it comes out, and there's no blood, and there was no pain. This then goes into an RNA preservation medium, directly in. I take my wire cutter and just the metal, snap. For each nose, I typically take 2 samples. Here I'm going to demonstrate the opposite side. Look straight at me. I'm going to gently open the nostril. You can see that turbinate there. I'm going to directly go right under that turbinate, put it underneath, and a little funny feeling, I could tell you feel that, but it's not too bad. 2 spins, and we're done. How was it?
The second one was definitely more.
You could feel
Like
it
I could
more?
feel the second one, yeah. But the first one was much.
It wasn't
Yeah,
really.
it's
It
completely
just a
fine.
little funny feeling you
Yeah.
have in your nose, yeah, and it's completely atraumatic.
Yeah.
And there are other, as long as they have, so a headlamp is sort of the ideal thing, but there are other, if for instance you had a second person holding up like a cell phone
Flashlight.
line or something like that, could that work as
also
well?
works, yep.
Okay. Trying to think of what could work for all the sides too. Okay.
Right, so let's see what happens if we do have any headlight. Let's just say put your head up into the light. Can I see the turbinate? I still can see the turbinate.
Yeah.
And so it's not essential, but the speculum I think is fairly essential to open the nostril.
Make sure you
If
get
you
the right
try
target.
to get a brush in there without this, you're going to be sampling the nasal vestibule,
Septum,
the
yeah.
skin, the septum. I'm going to be doing all the sampling on the way in. This gets you to go right to that. And it's also just with one finger, I can do 2 spins and pull it out. And it's not like an exact science of 2 spins, but I literally just take it and just brush along my finger, and that spins it around. Some people that just do like a half turn, I don't think you get enough cells doing that.
Yeah. Okay.